Welcome back, Missagh Manshadi joining us from Manshadi Pharmacy this afternoon. Welcome back to the show.
Thank you for having me, Susan.
It's great to have you, especially when we're talking about something that really pertains to our region, ticks. Ticks are an issue this year. It seems to be a hotter season for ticks this year than in years past.
Correct. It seems to be that our environment is getting warmer for environmental problems that we are going through, and there is more prevalent for ticks.
So let us look at these beautiful pictures of the ticks. These are the kind that we could find around here, essentially. These are crawling up somebody's arm. It looks like they're about to find a place to dig in.
Yes.
Have you seen this sort of thing when you at your pharmacy?
Well, there is actually approximately 20 species of ticks in British Columbia. 3 of them that actually bites human. And the ones that I have seen, basically one is called Rocky Mountain wood ticks. And also there is basically black-legged ticks, which causes Lyme disease.
Do you like what you're seeing here in terms of the extraction method, Missagh? Is this
Beautiful.
the way to do it?
It's a nice way to do it.
Yes.
I also brought a tweezer that I can actually show how to deal with it as well too.
Okay, so tell me a little bit about, we have some boards. Let's talk a little bit about those. Let's go to that first. Board number 1 with some facts on it. So we're going to get there. Here we go. So I'll let you take it away.
Sure. Important things. If you see a tick on your body, don't panic.
We do, but try not to.
Yeah, and move on. Another thing is you should remember, don't worry about ticks and not getting outside. Get outside and enjoy our beautiful BC province. Another thing is they don't jump, they don't fly, or they don't fall off the trees. They usually climb up. They sit on the, grasses or shrubs, and they climb up to their host. They need blood to survive, and ticks carry viruses, parasites, and bacteria. Lyme disease is a bacteria disease. That's why we give antibiotics. They are usually mostly found in backyards, and there's 3/4 of the bites that we get actually comes from our own backyard, not when we go hiking and so forth.
And that's a misconception. I think a lot of people think it's going to take going into the Lac du Bois grasslands, and you got to go frolicking through the flowery fields before one of these guys gets you, but often it's right in your own backyard. Correct.
Some people get symptoms, and usually takes between 3 days to 30 days to develop those symptoms. And if we get those symptoms, we usually seek medical attention.
Okay, so we're going to talk a little bit about what those symptoms are, and that's in the next board. These are the things to look for.
Yeah, basically you will see those fever, headache, fatigue, and also sometimes muscle aches and pain. And the bull's eye rash starts from the bite, and usually it grows in size. So it's not right away bull's eye, but it grows in size as days goes by. And if it's not treated, unfortunately, can cause neurological damage, MS symptoms, Parkinson's symptoms, and it can affect the joints, heart, and nervous system. We usually treat all the diseases with the antibiotic, but also we may have to deal with the antiparasites, antiviruses, and so forth. But usually we give antibiotics right away. They like the area of the body that they are warm and moist. That's why they usually find them in the scalp, the ears, armpits, maybe belly buttons, and so forth. I usually recommend to my children and my patients that when they go outdoors, they use DEETs, and they can also spray some on their clothing as well too. And remember something that it takes between 24 to 48 hours before that Lyme disease bacteria transmitted to human. So we have time if we get the bites to remove it and not be affected at all.
True to say, though, that the sooner you get treatment or seek help if you've been bitten, the better, because just the other day, I had a girl on who didn't realize she had been bitten. It took 11 years for the diagnosis of Lyme disease, and she has had so many health issues.
Correct.
I mean, I think the longer you wait, that's an extreme case, but
Yeah.
the longer you wait, the harder it is to treat it.
Yeah, and most of the bites, we get it from the nymph, which is the immature tick, and we can't see it because they are only 2 millimeter in size.
Oh, really?
Yes, and then also in their saliva is anesthetics, so it numbs the area, so we can't feel it.
Wow.
So that's why it makes it difficult to find them on the body.
Sure. We have one more set of points that we want to quickly get through. Perhaps we could put those ones up, starting with how to remove.
Correct. I brought this, if it is possible,
I
we
think
can
it is.
show that. If this is a tick, and basically we get the tweezer, and we go horizontally, and we go as close as possible to the skin, and we remove it upward. We don't, twist it or jerk it. We just grab it and remove it upward. That's the way to do it. Now, if you are in the wood and you don't have a tweezer, you can use your fingers. And that's a way to remove it as well, too.
Good to know.
Basically, you remove it, you wash it with alcohol, soap or water. Iodine scrubs are good too. And then you can put a little bit of antibiotic ointment on it. If you decided to go to a doctor, which is not necessary according to CDC, then you can take the tick with you. You don't have to kill it. Not always they give you antibiotic. The problem also with testing, it takes time before your body immune system produce antibodies. That's what the tests are not accurate right away. It has to be done maybe 4 to 6 weeks after the test done to find out. And remember, the month of June, August, July, August are the time that we have a lot more ticks out there, and then there's more chance of getting Lyme disease in our area. So,
one of my most basic questions is that I don't think our points covered is, if you were bitten by a tick and you extract it, you can see it's engorged. Is that a definite that you're going to get Lyme disease?
No, because that tick may even not been infected with the Lyme disease or other viruses or parasite. So we cannot assume if we have a gorged, tick on our body that we're going to for sure get the Lyme disease or other diseases. There is a possibility, and the faster remove it, the lesser chance you have that you get this diseases and so forth.
We're out of time, Missagh. This is a fascinating subject, particularly because this is a situation that is very, our region is really conducive to this sort of thing happening. So people need to be aware. I really appreciate your information today.
Thank you for inviting me.
Yeah, absolutely. And remember, if you do think that you're suffering from some side effects, you think you might have been bitten, you have fever, headache, or fatigue, you should absolutely go and see your doctor. There's no question in mind. If you have questions about this topic, of course, Missagh would be happy to answer them for you. The information is on the screen. We are back in 2 minutes. Stay with us.